It began like any other visit to the doctor. An elderly man, calm and polite, walked into the clinic complaining of mild fatigue and a touch of dizziness. His blood pressure was slightly elevated, his pulse slow but steady. The doctor smiled, reassured him, and prescribed another pill to control hypertension. Within weeks, that same man was rushed to the hospital in critical condition, not from his heart, but from a silent internal bleeding caused by a dangerous combination of medications. One small diagnostic shortcut had unleashed a cascade of consequences that nearly cost his life. This is not an isolated tragedy. Across the world, especially among older adults, one overlooked detail, one misjudged symptom, or one unnecessary prescription can become fatal. Doctors often carry the best intentions, yet they are trained within systems that move fast, reward certainty, and depend heavily on machines and checklists. In that rush, subtle human signals, the very clues that could save a life, go unnoticed. Japanese physicians have long studied these hidden mistakes, where a single routine decision becomes the seed of irreversible harm. In Japan, medicine for the elderly is rooted in patience and observation. Rather than assuming, doctors there are taught to pause, to listen, to look for what is not immediately visible. They view each older patient as a puzzle of interconnected systems, not a collection of separate organs. When a symptom appears, they first ask, what in this person's daily rhythm changed? This approach, though simple, prevents countless medical errors. In contrast, in many Western systems, an over-reliance on technology and standardized treatments can make the doctor blind to the quiet truths the body is whispering. For the elderly, that difference can mean life or death. With aging comes complexity, slower metabolism, overlapping conditions, and medications that interact like chemical dominoes. The same symptom can mean entirely different things in two people of the same age. But when care becomes mechanical, these nuances vanish. The mistake is not just in diagnosis, but in the mindset, believing that one formula fits all. Japanese doctors call this the invisible threshold, the point where medicine stops healing and starts harming. They emphasize that true medical wisdom lies not in prescribing more, but in knowing when to stop, when to observe, and when to question. The story of that man who almost died is a warning echoing through hospitals everywhere. Sometimes the most dangerous act is not neglect, but assumption. This journey will uncover the hidden traps within modern healthcare, especially those that silently threaten the lives of older adults. From medication overload to ignored symptoms, from over-testing to missed nutritional signs, each mistake hides a deeper pattern. As we move forward, you'll see how Japanese medical philosophy, built on minimalism, observation, and respect for the body's rhythm, reveals a safer path. The first step is to understand why seniors are uniquely vulnerable, and how one small oversight can ripple into disaster. The aging body is a masterpiece of adaptation, yet it carries layers of quiet fragility that many doctors underestimate. Every cell slows its rhythm, every organ adjusts its function, and medications linger longer in the bloodstream than they once did. What worked perfectly in middle age may turn toxic in later years, yet medical routines rarely adapt with the same sensitivity. This is where danger hides, not in dramatic failures, but in subtle mismatches between old habits of treatment and new realities of aging biology. When a doctor treats a 70-year-old patient as if they were 50, every decision carries unseen risk. The liver metabolizes drugs more slowly. Kidneys clear them less efficiently. The body's internal thermostat, blood pressure control, and immune defenses all lose some precision. A dose that once healed can suddenly harm. Still, these gradual shifts are easy to miss in a busy clinic, where appointments last minutes and records are buried under electronic screens. The mistake is quiet, but cumulative. Japanese geriatric specialists view these changes as a living map to be read with patience. Before writing a single prescription, they observe how a patient moves, speaks, and reacts to temperature or taste. They notice tremors when reaching for tea, the pace of a morning walk, the sparkle or dullness in conversation. Each detail tells them how the inner systems are coping. This method, grounded in observation rather than assumption, helps them avoid the cascade of errors that comes when doctors treat symptoms instead of understanding the whole pattern. In many other medical systems, however, time pressure breeds shortcuts. Symptoms are matched to drugs instead of being decoded as messages. A cough becomes respiratory infection, dizziness becomes low blood pressure, fatigue becomes aging. But in reality, those signals may reveal deeper imbalances: dehydration, malnutrition, or side effects of multiple drugs colliding in the bloodstream. When a physician ignores these nuances, the elderly patient becomes vulnerable, not because of age itself, but because of medical oversimplification. This vulnerability deepens with what experts call polypharmacy, the simultaneous use of several medications. Each pill interacts with others in unpredictable ways, sometimes multiplying risks that no single doctor sees in isolation. Japanese doctors counter this by regularly reviewing every drug their patients take, often removing unnecessary ones. Their goal is balance, not abundance. They believe that medicine should support the body's rhythm, not dominate it. Understanding this delicate interplay between biology and care is the foundation for safety in old age. Aging does not automatically mean decline, it means transformation. The danger arises when medicine fails to transform with it. In the next chapter, we'll step deeper into the heart of the problem: how one small diagnostic habit, repeated daily across the world, can turn an act of healing into a hidden threat. It often begins with confidence. A doctor sees a familiar pattern, recognizes a set of symptoms, and quickly connects them to a common diagnosis. Chest pain? Probably the heart. Dizziness? Likely blood pressure, confusion, perhaps age. These shortcuts, known in medicine as diagnostic heuristics, are meant to save time. But when applied to older adults, they can become silent traps. A small assumption can blind even the most experienced physician to what is truly happening inside the patient's body. Japanese doctors describe this as the shadow of the first impression. Once a diagnosis is made in the first few minutes of consultation, every symptom that follows is filtered through that lens. An elderly woman arrives complaining of fatigue and stomach discomfort. The doctor sees her age, notes mild anemia, and prescribes iron supplements. Months later, she is diagnosed with stomach cancer that could have been caught earlier if someone had looked beyond the obvious. The original mistake wasn't ignorance. It was the human mind's tendency to confirm what it expects to see. In Japan, geriatric medicine is designed to resist this bias. Instead of relying on rapid conclusions, doctors are trained to use what they call MA, the pause between observation and decision. This pause allows space for reflection, for asking one more question, for testing a small hypothesis before committing to a diagnosis. In the eyes of a Japanese clinician, that silence is not hesitation, but wisdom. It's the moment where a life may be saved by patience. Contrast this with the pace of modern healthcare elsewhere, where productivity metrics and digital systems reward speed over depth. A patient may see several specialists, each focusing on a single organ rather than the entire person. The heart doctor never asks about digestion. The neurologist doesn't check hydration. The general practitioner assumes someone else is watching. The result is fragmentation. The patient becomes a puzzle no one fully solves. For older adults, these fragmented decisions create a dangerous illusion. Everything seems managed, yet no one sees the whole. In Japan, doctors still value house calls, where they can observe how a person lives, eats, and interacts with their surroundings. They believe the environment often reveals what lab tests can't, the real story behind recurring symptoms. This holistic approach transforms diagnosis from a checklist into an investigation of lifestyle, rhythm, and context. Avoiding the diagnostic trap requires humility, the willingness to say, "I might be wrong." It's a phrase that can change everything. For elderly patients and their families, learning to ask questions, to describe patterns beyond single symptoms, and to gently challenge assumptions can be life-saving. The lesson from Japan is clear. In medicine, certainty can be the most dangerous illusion of all. As we continue, we'll uncover how that same misplaced confidence extends to medication itself, turning healing pills into hidden poisons. The small white pills that line medicine cabinets across the world promise relief, control, and protection. Yet for many older adults, those same pills silently weave a web of danger. Every prescription begins with good intent. A doctor addressing a symptom, a specialist treating an organ, a guideline followed faithfully. But over time, one pill becomes five become 10, and soon the body is asked to navigate a chemical maze it can no longer manage. This is the quiet epidemic of polypharmacy, one of the most underestimated threats in modern medicine. Each drug has its purpose, but together they can clash like competing signals in the same circuit. One lowers blood pressure, another affects heart rhythm, a third alters kidney function. Side effects overlap and disguise themselves as new illnesses. A patient grows dizzy, falls, or becomes confused, and another pill is added to fix the new problem, which was actually caused by the first. It's a loop that spirals until the true cause disappears under layers of treatment. In Japan, physicians have long recognized the peril of excess medication. Their guiding principle, yaku wa ryo-yaku ni shaite doku, medicine can be both cure and poison, reminds them that healing depends on balance, not quantity. Japanese geriatric doctors conduct regular prescription audits, sessions dedicated to reviewing every drug an elderly patient takes. The goal is subtraction, not addition. By asking whether each medication still serves a clear purpose, they protect the body's ability to regulate itself naturally. This restraint is not neglect, it is precision. Studies from Tokyo Medical University show that reducing unnecessary medications can lower hospitalizations by up to 30% among older adults. Patients often report feeling clearer, steadier, and more energetic once the chemical load is lightened. The body, freed from constant interference, regains its quiet intelligence, the natural rhythm of healing that excessive intervention can disrupt. In contrast, many healthcare systems reward prescribing more than reviewing. Each specialist acts within a narrow domain, unaware of what others have prescribed. The result is a chemical chorus out of tune. Blood thinners combined with anti-inflammatories cause internal bleeding. Sleep aids interact with blood pressure drugs to slow heart rate. Even over-the-counter supplements taken with the best intentions can amplify risks. What appears as a small headache or fainting spell can suddenly turn catastrophic. Japanese doctors teach that medicine should serve as a bridge, something to support the body until it can walk again on its own. When drugs become permanent scaffolding, they weaken rather than strengthen. For older adults and their caregivers, the first act of self-protection is awareness. Knowing every medication's purpose, questioning overlaps, and asking doctors, "Can I safely take less?" The Japanese approach reminds us that health is not found in the number of prescriptions, but in the harmony between body and medicine. And sometimes, the first step to healing is removing what no longer serves. When an older patient feels unwell, the symptoms often refuse to fit the textbook. A younger person with a heart problem may clutch their chest in sharp pain, but an elder might only complain of fatigue or mild indigestion. A stroke in a younger adult can manifest as slurred speech or paralysis, while in an older one it may begin with confusion or a brief stumble. These subtle differences make diagnosis a challenge, and when doctors rely solely on classic patterns, they can overlook deadly warning signs hiding behind ordinary complaints. This is one of the greatest diagnostic blind spots in modern medicine. The elderly body speaks in whispers, not shouts. Pain is dulled, inflammation muted, and immune responses softened. A fever may never appear, even when infection rages. Because of this, serious conditions can quietly progress while physicians reassure patients that nothing seems urgent. The danger lies in the assumption that no pain means no problem. In Japan, medical education emphasizes what is called Minari no Bio, the disease that disguises itself. Students are trained to listen beyond words, to study posture, skin tone, and even the way a person sits down. A sudden change in walking rhythm, a pause before standing, a slower reaction to greeting. Each detail can reveal what laboratory tests may miss. Japanese doctors believe that observing how someone moves through daily life tells more about their health than a dozen machines can capture. Western medicine often compartmentalizes symptoms. Fatigue goes to the internist, dizziness to the cardiologist, confusion to the neurologist. Each expert examines a single tree while the forest burns quietly behind them. Japan's holistic model, in contrast, encourages cross-disciplinary awareness. A patient's dizziness might relate not only to blood pressure but to dehydration from medications or poor nutrition. Instead of jumping to conclusions, physicians there explore patterns, how the symptom fits within the larger rhythm of the person's days. This method saves lives. A study from Kyoto University Hospital found that older adults whose care teams discussed non-classic symptoms had a 30% higher survival rate over 5 years compared to those treated conventionally. It's not advanced technology that makes the difference. It's the willingness to question appearances. When an older person says, "I just feel off," that vague phrase may carry the weight of a crisis waiting to unfold. For families and caregivers, the lesson is simple but profound. Never dismiss mild changes as just aging. A new tendency to nap during the day, a loss of appetite, or moments of confusion may be early messages from the body. The Japanese approach teaches us to respect those whispers, to act before silence becomes danger. As we move forward, we will explore another modern pitfall that hides behind good intentions, the overuse of medical technology and testing, and how what seems like thorough care can sometimes lead to harm. In the modern hospital, machines hum and screens glow with promise. Technology has become the symbol of advanced care. The more tests, the better the medicine seems. Yet for many older adults, this devotion to technology can quietly turn against them. Scans, blood tests, and procedures meant to protect can sometimes harm, especially when performed without clear purpose. This is the paradox of overtesting, the search for certainty that often leads to unnecessary fear, treatment, and suffering. It begins with good intentions. A doctor wants to be thorough, to rule out every possibility. But each test, no matter how simple, carries risk: physical, emotional, and financial. A CT scan exposes the body to radiation. A biopsy may cause bleeding or infection. Even blood tests can trigger a cascade of new investigations if one number falls slightly outside the normal range. For an older person whose body is already balancing on a delicate threshold, these intrusions can do more harm than good. Japanese doctors are taught an old principle called Kenko no Seigyo, or restraint in health. It teaches that medicine should act like a gardener, pruning only what is necessary to allow natural balance to return. Before ordering a test, a Japanese physician asks 3 questions. Will it change how I treat this patient? Does it help the patient understand their condition? Does it align with their quality of life? If the answer to any of these is no, the test is postponed or avoided entirely. This thoughtful restraint is not laziness. It's a form of respect for the body's integrity. In contrast, medical systems elsewhere often reward excess. Defensive medicine, testing to avoid lawsuits, drives many unnecessary procedures. The culture of more is safer leads to overdiagnosis, where harmless conditions are labeled as disease. An elderly patient might discover a small, slow-growing tumor that would never have caused harm, yet once detected, it triggers anxiety, surgery, and complications. The discovery feels like progress, but becomes a burden. A study from the University of Tokyo revealed that among adults over 70, nearly 40% of imaging tests ordered in hospitals did not alter treatment plans. When doctors were trained to apply selective testing guidelines, the number of complications dropped significantly, and patient satisfaction rose. Less intervention, it turned out, led to better outcomes. For seniors, understanding this can be life-saving. The goal of testing should never be to collect more data but to find meaningful answers. Patients and families can protect themselves by asking, "What decision will this test change?" or "What happens if we simply wait and observe?" These questions invite dialogue rather than blind trust. Japanese physicians remind us that medicine is most powerful when it knows when to stop. True care is not measured by the number of scans, but by the wisdom to choose which ones truly matter. And that wisdom extends far beyond machines. into the simple daily acts that sustain the body from within, starting with how and what we eat. Food is the quiet medicine the body takes every day, yet in the lives of many older adults, it is the first prescription forgotten. A doctor may carefully adjust blood pressure drugs or schedule new tests, but rarely asks the most revealing question: what have you been eating? Malnutrition, hidden deficiencies, and neglected gut health are silent epidemics among seniors, and they often masquerade as illness. A loss of appetite, constant fatigue, or weakness can all stem not from disease, but from missing nutrients that no pill can replace. The elderly digestive system changes with age. Stomach acid declines, chewing becomes harder, and the sense of taste dulls, reducing both pleasure and nutrition. Many medicines worsen the problem by irritating the gut or blocking absorption of vitamins. The result is a slow erosion of vitality, unnoticed by doctors who may attribute the symptoms to normal aging. But in Japan, nutrition is viewed as a cornerstone of medical care, not an afterthought. Japanese doctors and dietitians share a concept known as shoku iku, food education as lifelong therapy. Hospitals there often include nutrition counseling as part of every consultation. Rather than prescribing supplements, they encourage natural nourishment through variety, color, and fermentation. Foods like miso, natto, and pickled vegetables feed the gut's microbiome, improving immunity, mood, and metabolism. The emphasis is not only on what to eat, but how, slowly, mindfully, and in balance with the seasons. Western healthcare tends to separate diet from diagnosis. Specialists treat anemia with iron tablets instead of asking about meals. They address fatigue with stimulants instead of checking for protein intake. In Japan, these patterns are reversed. Food is the first question, not the last. When an older patient complains of dizziness or weakness, doctors often inspect meal logs before ordering tests. They understand that the gut, brain, and immune system form one continuous dialogue. When the gut weakens, the entire body loses its equilibrium. A landmark study from Osaka University showed that elderly patients who consumed fermented foods daily had significantly lower rates of infection and cognitive decline compared to those who followed Western-style diets. The key wasn't just nutrients, but microbial diversity, the living bacteria that keep the immune system responsive and inflammation in check. It's a kind of invisible armor that pills cannot mimic. For families caring for elders, this lesson is vital. A balanced plate, rich in color and texture, often heals more deeply than another prescription. Even small rituals, like sharing tea or soup at regular hours, help regulate digestion and mood. The Japanese approach teaches that nourishment is both biological and emotional, a daily renewal of life's rhythm. And just as food sustains, neglecting another everyday act can destroy. What enters through the mouth matters, but what happens inside it, the health of the teeth, gums, and swallowing muscles, can mean the difference between longevity and decline. Few realize that one of the most common causes of death among older adults begins not in the lungs but in the mouth. Poor dental health, weakened swallowing muscles, and unnoticed aspiration, tiny amounts of food or liquid entering the airway, can lead to pneumonia that quietly takes thousands of lives each year. It's an invisible danger, one often missed by doctors focused on blood tests and scans. Yet in Japan, physicians have long understood that the mouth is a mirror of overall health, and caring for it is as essential as caring for the heart. With age, saliva production decreases, teeth weaken, and dentures fit less securely. Chewing becomes tiring, so many elders shift towards softer, processed foods that are easier to swallow but far less nutritious. The throat muscles, no longer challenged by chewing and swallowing, grow weaker. Over time, tiny particles of food or saliva can slip into the lungs unnoticed. This process, called silent aspiration, triggers chronic inflammation and infection. The tragedy is that it's often preventable through simple daily care. Japanese geriatric medicine treats oral health as a medical priority. Hospitals conduct regular swallowing checkups and even employ dental hygienists as part of inpatient care teams. Before each meal, caregivers may guide patients through short exercises to strengthen the tongue and throat. In nursing homes, residents are encouraged to brush or rinse after every meal, not merely for cleanliness but to stimulate nerves and keep muscles active. The philosophy is clear: prevention begins in the mouth. In contrast, many healthcare systems treat dental care as separate from medical care. A patient may see a doctor for recurring pneumonia without anyone checking oral hygiene or chewing ability. Studies from the Japanese Society of Gerodontology show that integrating oral care into routine elder treatment reduced pneumonia-related deaths by nearly half. The data reveal a truth that technology alone often misses: that longevity depends on the smallest, most human habits. Beyond physical health, oral care also preserves dignity. Being able to eat without fear of choking, to smile without pain, to enjoy conversation, these are quiet foundations of quality of life. Japanese culture recognizes this emotional dimension. Meals are shared rituals, expressions of gratitude for nourishment. Keeping the mouth healthy is seen not as vanity, but as respect for life itself. For older adults and their families, small steps make profound differences. Regular dental visits, staying hydrated to maintain saliva flow, practicing slow chewing, and avoiding eating while distracted. These habits maintain safety and pleasure in eating, transforming meals from risk to renewal. The Japanese approach reminds us that aging gracefully is not only about treating disease but maintaining connection with food, with movement, with others. And among those connections, one of the most vital is the link between body and community, where loneliness can become as harmful as any physical illness. Loneliness may not show up on a medical chart, but its effects are as destructive as any chronic disease. Among older adults, isolation quietly raises blood pressure, weakens immunity, and increases the risk of dementia and early death. Yet many doctors still focus solely on lab values, overlooking the emotional currents that sustain health. In Japan, where the population is among the oldest in the world, physicians and communities have learned that wellness depends as much on connection, rest, and gentle movement as on medicine itself. Across Japanese towns, early mornings bring a familiar sight: groups of elders gathering in parks to perform radio taiso, short calisthenic routines broadcast nationwide. The movements are simple: stretching, bending, slow arm circles, yet deeply symbolic. They keep joints flexible, stimulate circulation, and perhaps most importantly, weave social bonds that guard against loneliness. Doctors in Japan often prescribe participation in these group exercises, the same way Western physicians prescribe medication. The goal is not intensity but rhythm, aligning body, mind, and community. Sleep, too, is treated differently. While many healthcare systems treat insomnia in seniors with sedatives that dull the senses, Japanese medicine views disrupted sleep as a sign that the day's rhythm has been broken. Elders are encouraged to seek morning light, take short naps, and limit evening stimulation. Studies from Tohoku University show that restoring natural light exposure can improve memory and balance in older adults more effectively than sleeping pills. The Japanese believe that rest is not merely absence of activity, but a healing phase in the body's daily cycle. Equally vital is emotional nourishment. In small villages and city neighborhoods alike, ikigai circles, community groups centered on purpose, help elders stay mentally sharp and emotionally grounded. Members share crafts, cooking, gardening, or storytelling. Doctors who track these groups note that participants report lower pain levels, improved mood, and a slower rate of cognitive decline. Connection itself becomes medicine, a treatment that no pharmacy can provide. Western doctors are beginning to recognize this too. The World Health Organization now identifies social isolation as a major health risk for seniors, comparable to smoking or obesity. Yet Japan's decades of experience offer a roadmap: prevention through daily engagement, gentle movement, and respect for routine. These simple acts keep the nervous system balanced and reduce the body's inflammatory responses, the very roots of many age-related diseases. For elders and families everywhere, these lessons hold immense power. A 10-minute morning walk, shared meals, sunlight on the face, and conversations with neighbors can rebuild the foundations of vitality. Medicine may treat symptoms, but connection restores the will to live fully. And at the heart of this wisdom lies one final principle that binds all others together: the courage to question, to seek understanding, and to take an active role in one's own care. That empowerment, long valued in Japanese culture, is the final safeguard against the doctor's mistake that can cost a life. Trust is essential between doctor and patient, yet blind trust can become a silent danger. Many older adults raised in an era when authority was rarely questioned accept medical advice without hesitation. They believe the doctor always knows best, and in many cases that trust is deserved. But when communication fails, when questions go unasked, even the most skilled physician can make an error that slips past unnoticed. Empowerment, the confidence to ask, to verify, to understand, is the final defense between safety and catastrophe. In Japan, the doctor-patient relationship has evolved around a philosophy known as Rincho no Kokoro, the heart of clinical practice. It teaches that medicine is not a one-way command, but a shared dialogue. Japanese doctors often begin consultations with a pause, allowing patients to describe their lives, not just their symptoms. They invite families into the discussion, treating health as a collective responsibility. This partnership transforms the patient from a passive recipient into an active participant. When questions are welcomed, mistakes are caught early, and outcomes improve. In many Western systems, time pressure often suppresses this dialogue. Appointments are brief and elders may feel rushed or intimidated, yet small shifts can reclaim that power. Simply asking, "What are the alternatives?" or "What happens if we wait?" opens space for safer choices. Keeping a written list of medications, tracking side effects, and bringing a relative to appointments all strengthen protection. These are not acts of defiance, but of shared vigilance. Japanese culture encourages this mindset through lifelong Kenko no Manabi, the study of health. Community centers host workshops where elders learn to read medical labels, measure pulse and blood pressure, and understand test results. Doctors teach prevention as collaboration. This public health education builds confidence, ensuring that no one must rely solely on faith and authority. Knowledge, in this sense, becomes the purest medicine. Aging, when met with awareness, becomes not decline, but refinement. The Japanese ideal of aging gracefully, shibui, quiet strength, reflects balance between humility and agency. It accepts guidance from doctors, yet never relinquishes curiosity or control. That balance is what prevents the one doctor mistake from becoming fatal. For those watching over parents or grandparents, empowerment means presence. Attend appointments, take notes, ask why each medication exists, and request second opinions when something feels wrong. Most errors are not born from negligence but from assumptions left unchallenged. The courage to speak, even gently, can save a life. In the end, the greatest lesson from Japanese medicine is simple. Healing is a partnership built on awareness. When patients and doctors listen to one another, truly listen, the invisible dangers of modern healthcare lose their power. The wisdom of restraint, observation, and connection forms a circle of safety. Within that circle, aging is not feared, but honored, and life, even in its later chapters, retains its quiet brilliance.